Good afternoon, ladies and gentlemen. Good afternoon and welcome. Welcome to the 8th episode of EPHA's Access to Medicines Dialogues. This is the series we started last year in our attempt to expand the conversation. And today it is a privilege and a great pleasure to be joined by Clemens Auer. Clemens Auer is a special envoy for health for Austria. He was, up until recently, the co-chair of the EU steering board in charge of the negotiations for the EU vaccine deals. Clemens has decades of experience in national policy making, but also European policy making in the Ministry of Health of Austria, now also on the executive board of the World Health Organization, but also he is the president of the European Health Forum, Gastein. Thank you, Clemens, for joining. Thank you for giving us your time and for helping us understand what has happened behind the scenes since last June, when the EU vaccine strategy was launched. Before I go on with my first question, I would like to remind you all to engage on Twitter using the hashtag Access to Medicines Dialogues, A2M Dialogues. You can watch all of the previous sessions of A2M Dialogues on the EPHA YouTube channel. And of course, join us for the next episode, which is going to be in June. The session is recorded, and feel free to also ask your questions in the Q&A chat room. So Clemens, it's a pleasure to have you. Thank you so much. I know you are still very, very busy. Take us a bit back in time. Take us back to last June. How did it start? How did you get involved? Did you get a call one day telling you, do you want to be the co-chair of the steering board?
Yeah, it was probably pretty much that way, because there was some dynamic going on the vaccine market, because the first companies approached governments in the capitals, and some governments already reacted. And remember, there were this group of 4 member states, Germany and the Netherlands, France and Italy, who already signed somehow a letter of intent with AstraZeneca. So that the other capitals all of a sudden got a little bit nervous. There was some outspoken protest against it. But no, it was very constructive. In the end, it went very, very fast. And mid-June, I think, we joined the first time as this group of 27 member states together with the European Commission, and said, now we will do this together, because it doesn't make sense that we 27 do separate contracts with potential vaccine producers. No, went very fast. And even for me, as an old student of European affairs, I was surprised how fast it went, but it was good that way.
Indeed, and we are almost 1 year later, and I must say that the EU vaccine strategy, the joint procurement initiative, is undeniably a success story, still, irrespective of the problems that we had along the way. And it did prevent a divided Europe. But again, going back to the first steps, what was your mandate? How did you and your colleagues, where did you get your instructions from? What was your mandate, and which were your absolute key priorities at the very beginning of this process? Was it the price of the vaccines? Was it?
No, we all had them, the 27 member states together with European Commission. We had one big mandate, to secure enough vaccines to protect the European citizens together, and we have 450 million people in the European Union. And so we had to make sure that 450 million people have access to affordable, high quality, safe vaccines. That was our mandate, So for me personally, I had a mandate to secure access for 8 million Austrians, for the vaccines. So, it was not very clear from the very beginning, how much the coverage should be, should it be 20%, 30%, 50%, 70%. For me, it was clear I had a mandate to cover 100%. So that was the beginning. The second point was then, to select the potential candidates which we want to talk with, and that was, we had a very clear strategy or mandate there too. It was, is the candidate, the potential candidate, the potential manufacturer capable of producing a quality vaccine, which will also pass European market authorization, so the high standards of EMA. Will the producer be capable to put this as early as possible on the market? In June 2020, there was already talk that we might have vaccines up and ready end of 2020. So that was somehow a target date. And of course, there should be a strong European component when it comes to manufacturing and supply. And the price, of course, was also one of the points, but not the most important. The most important one was quality. Will it pass the high European standards of quality? Because, back then in 2020, summer 2020, people like me, we had one big concern. Will people, the populace, trust in this rapid production or development, not production, but development of vaccines? So it was for us very important that we did everything to make sure that we have quality products in the pipeline.
And you mentioned the selection of the vaccine candidates. You mentioned that the companies started approaching the governments. Did I understand correctly?
Some companies started approaching some governments, not the 27, but some companies approached us, and asked us to do pre-purchasing agreements or advanced purchasing agreements. This is how this business is usually conducted. I'm an old lad, and I made this advanced purchasing agreements back in the influenza pandemic times for the Republic of Austria. So this is not something that new, this is how things are done, because it's a very tricky thing. You make an advanced purchasing agreement, so both parties commit themselves on something which doesn't even exist yet. So this is legally and economically very tricky question. But on the other hand, you have to do this kind of advanced purchasing agreements, because otherwise the producer won't be able to supply you if you are not early on. So you always have to stay back in the line, if others have this kind of advanced purchasing agreements. See, and this was the key, because the 27 committed themselves to do it together, not on the basis of first come, first serves, but we all committed ourselves that we get the vaccines to the same time, pro rata, according to population share. And that was very important. Can you imagine if some of us member states would have been individually earlier with a potential producer with an advanced purchasing agreement, all the others would have go back in line and wait. But, and this is one of the successes. You're totally right, and I'm a preacher now that this success story shouldn't be undervalued, because this is so important that we did it together, and that all European citizens have to the same time access to whatever we purchase together.
Can I ask you, when you started your job with the steering board, there was already a contract on the table. The one signed already late May, early June last year by the IVA, the Inclusive Vaccine Alliance, namely Germany, France, Netherlands, and Italy. And that was the contract with AstraZeneca. At the time, it was the cheapest and the biggest contract. So that was already on the table for you. What did that mean for you? Because that contract was essentially taken over by the EU in August. And it was officially signed.
Yes, but the four governments, you mentioned, they decided to hand over that early, commitment, so to say, on to this easy funding project of the European Commission, so that all the 27 will have access to this 300 million that already was fixed in this letter of intent. 300 million doses plus, I think, another 100 options and this was then available for all 27, not only for the 4. And it took a while so that the Commission was capable of putting that then under a contract according to the commission standards, because the commission has standards, they have to follow the rules of calling tenders and certain things, procurement standards. Because but and that's also very important to remember. We as a steering board, and this was also our political mandate, we didn't want to rely just on one technology when it comes to vaccines. We wanted to have a risk portfolio where we cover potentially all the different technologies for developing vaccines or producing vaccines. So Astra was a vector vaccines, as we know, but there was also this new technology on the table, this mRNAs, and that was a very, I don't want to say it was a very, very difficult question, but it was a challenging question because we all knew that there never has been mRNA vaccines on a large amount produced somewhere and put on the market, or has gotten even a conditional market authorization or market authorization at all. So that was one thing. But science back in the summer 2020 was already so advanced that they told us, our scientific advisory we received, saying you are sure, you're on the sure side, on the safe side, to also work with mRNA producers. And then, there's a subunit, blah, 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 other technologies. So we wanted to have all these technologies represented in our risk portfolio, because we wanted to make sure that even if one of these technology doesn't get a market authorization, we still have enough dosages to cover the needs for the European citizens. That was always the strategy. Even, and that's actually, that's how it ended up, even if we overbook, so to say, and we are making contracts with for much too many doses to cover 450 million people.
Clemens, if I hear you correctly, and if I understand, there wasn't such a thoroughly thought through needs assessment done at the time as to what exactly we needed, how many doses. It was a bit kind of a shot in the dark, or not? mRNA or non-mRNA?
No. I think one of the first exercises we did in the steering board, of course, was to assess the needs. So we had two tables, and for each and every member state to express interest, how many doses they want. And and that was still very, very early on. Some member states followed more the traditional public health advice to only cover the high risk groups and the healthcare workers. I definitely was on the other side of that, because I always said to my colleagues, your prime minister or your minister, they have you have a teachers union, and if you only secure access for high risk groups and healthcare workers, so roughly 20-30% of your population, then you will get into political troubles, because you have export-oriented industries. They want to cover their employees with vaccines. So that was a discourse and a dialectical process, so to say. And in the end, we all covered, for 100% of our populace, but that took a while. But it was not a there was not a critical discussion, or it was not even divisive. But to overcome this classic public health stand, and to be broader. And I think rightly so. I think we didn't make a mistake back then to really go after, covering the whole population.
Back then, in the early days, last summer, how much were the developments in the US, in Israel, in the UK on your radar? Was that a source of stress, anxiety, or pressure even? And if you can tell us, from what you remember, last July and last August, early September, what was the pressure that you felt the most?
No, we had a certain pressure. Israel was not the pressure, but more or less the United States, because that's a big market, and so to say also for us, as European Union, a big competitor when it comes to access and securing the access to potential vaccines. So that was, of course, always on our radar. What are the US doing? What are the US doing? Are they negotiating pre-purchasing contracts also, like we did? What might their India, or strategy B, etc., etc. So that was on our radar. Israel was not on our radar, not because Israel is not important. Back then, we even wanted, there was a discussion, it didn't materialize, but, to cover also Israel under our contracts, as we covered Norway, Iceland, Liechtenstein, and for a certain amount also Switzerland. But, and we wanted to invite Israel early on, but Israel went its own way, as we all know. But no, so if you ask me, the only competitor, so to say, was if at all, the US.
And there was a feeling that you need to sign the contracts very fast, or not? And also when it comes to the US, I guess you were afraid always since that time, the possibility of export bans, or not?
Now, see, the thing is, with this kind of contract, the companies also pressure you a little bit, because they say, if you don't sign these APAs, we will sign another APA, and then you have to go back in line, but this was not wasn't very easy for the companies, for the European Union, if you have a 450 million people market, so this is the largest market, by the way, worldwide, globally the largest. So yes, so we had, Sandra, Galina, and me, as chairs of this troop, so to say, we had a certain pressure because we had to deliver something. We had to show that this process is working, because in many capitals there's always this conspicuous. If something is done on the European level, it takes forever. And Sandra and I, we always said, no, this time we won't do this. We will be very, very fast and quick. And, we had a joint negotiation team, or still have a joint negotiation team with representatives from member states and the Commission. So there was this trust building element also between us, the member states and the Commission. And so we started negotiating and talking with our potential candidates very, very immediately after June, after mid-June. We started talks with Astra, with Johnson, with Sanofi, with BioNTech back then. Pfizer joined later. I think we also started very, very early on with Moderna. 6 candidates we had in the pipeline already end of June.
Let's go a bit to pharma's attitude towards you and the negotiation of the EU. How were the companies behaving? Because I remember both you and Sandra Galina in the past have stated on the record that pharma also tried to rip you off, not you personally, but the EU, in the sense of charging or demanding for some excessive prices, at least at the beginning.
Yes, we are all old enough to know that pharma is pharma, but and there were some, it's not me to say that, the pharma people should say that, but there were some attempts on the pharma side also to unite on their side. It was not very easy for them that all the 27 European member states, EU member states, and the Commission is sitting on one side of a table as a block. They wanted us to be divided. This is how business is done in that industry. So that was some, they also wanted to unite. But I think the industry associations failed globally and within Europe doing that, because some companies went out and did their own thing, and Astra, and, we have to say, with all the troubles we have with AstraZeneca, there's one positive point we really have to acknowledge, and that's an impeccable point. They came to us, to our negotiating table, and said, we don't want to make the big bucks out of this. We price you fair, a non-profit price for the world, so to say. And I think that set the standard and the tone for the rest of the industry, very much so. But the American companies, or let's say so, the biotech companies, so with the new technology, they had another fantasy what pricing is when it comes to pricing. And they also approached us, without giving any details here, but their mentality was, we do have a new technology here, mRNA, That's the future of vaccine production. And you have to reward our development, so to say. And that has to reflect the price. And as you see, if you look at our portfolio, it reflects the price because the mRNAs are more expensive than the traditional ones. But I think altogether, AstraZeneca, but then also Johnson & Johnson, which also announced very early on to have a price calculation for a profit, non-for-profit, of non-profit, so to say, and maybe a little plus, and so in the end, it was very fast, very clear on the table that the companies who had the fantasies of only to have commercial pricing, they didn't come far with that,
And you don't believe that had you accepted to pay higher prices, things might have gone a bit better in terms of deliveries and respect of commitments?
No, Yanis. No, Yanis. I have to say a loud and strong no. These are the fantasies of some economists. Economy professors can say that, who don't have a clue how medicines or vaccines are developed and then also produced. It takes a time to develop a vaccine. It takes a time to set up the production line and then to produce them in large quantities. No one of these companies ever had produced in that large quantities, because it's you are an expert, Yanis, that vaccines, vaccine production is not a mass production, so to say, but all of a sudden they had to produce it on high scales, that's large scale production. So no, I think the best witness, it's not me to say that, the best witness is one of the CEOs of BioNTech said that, even if we all would have paid higher prices, BioNTech wouldn't have been able to produce faster. One point. The second point is, because we did it together and the European Commission chipped in more than 2 billion euros, and the member states also chipped in 700 million on top of that. So we had a budget, so to say, for more than 2.7 billion euros. And we used that 2.7 billion euros very strategically to say, friends, we are signing with you an APA. We do know that you need capital, you need cash right away to scale up your production. So all these companies received quite a bit of money to do their homework to scale up production. And that's also the success story, at least of these companies who are delivering now and supplying the European market large scale. And some of them do. Some others have a problem, of course.
So on the negotiations, what would you say to those who claim that you, with your negotiation tactics, you wasted precious time by insisting on low prices? And then I will come also to the issue of the liability, but don't answer on that yet, please.
No, I think I think the people have to understand the timeline. The most important part of the negotiation actually was to agree on a term sheet, because the companies had to come to our negotiation table and to offer us something, which we can build on then a tender, because the Commission had to ask, call a tender, and then after that process, and after the tender, the call is answered by the producer, then the actual contract will be negotiated and made. But all these templates, these term sheets, they already included the price, the volumes, and this, more or less, the specifications of the product. And all these term sheets were negotiated very, very early on. Because they were the key. Without this term sheet, the Commission never would have been able to call for a tender, so to say. So, it doesn't matter if the contract physically was signed in October or November. No, that was all the most important part was already done. The price, the quantities, and the early descriptions of the quality. The contracts later on were, that was the lawyer's work then. And also the term sheets were lawyer work, because they also, because you will ask me that, I know, is the conditions of liability, etc., was also already put into the term sheets. And we didn't communicate much about the negotiations of term sheets and when we finalized that. Remember that we didn't communicate that. It was, I think it was more, I can't remember, went also fast and so many things happened simultaneously. I think the commission always communicated when they have a call of tender out with which company, and definitely when we sign the contract, when the negotiation process was finalized. But it was as at least a 3-step process. And the most important for me, politically and internally, strategically, was the talks on the term sheet.
That's clear. Thank you. That's enlightening. Now, last August, we are in late last August. There is a story on the front page of the Financial Times revealing that there was an internal memo by a pharma trade association in Brussels, revealing that pharma was pushing in those negotiations with you for unprecedented civil liability exemption. And that triggers a scrutiny also in the European Parliament. I remember it was September 7th for the first time that Sandra Gallina appeared before the Parliament, and she was bombarded with questions across the political spectrum, especially on the liability. When was this an issue in the negotiations? When was this on your radar? And I have a question, I've always had this question. Was this an issue that was mostly championed by some and considered to be less important by others? I'm talking about member states. Or were all member states equally keen on this?
I revealed here that, and I mentioned that for me, strategically, the most important part of the negotiation was the talks on the term sheet. And of course, but for the audience the audience, or the members in the audience here who are not so familiar with talks between a pharmaceutical company and a reimburser or a government or whatever, the lawyers in the pharmaceutical world, on the pharmaceutical side, they are risk adverse. Let's say so, as we public servants are also, we're all risk adverse somehow. But the point here is that the lawyers wanted to protect their mother companies, from potential damages if the vaccines are failing. Luckily enough, the other vaccines who have now a conditional market authorization didn't fail and didn't produce any harm. So, in the retrospective, it was an awkward discussion maybe, because they were all of these companies are good companies and highly reliable companies, and they wanted to do a good job, and all of them did a good job so far. But yes, in terms of their risk advertisement, the lawyers tried to protect the companies and wanted to derail the risks onto us, because they said, you are pushing us, you governments, you European Commission, you are pushing us to develop fast, to produce fast, to protect the European citizens. And if it's fast, there can't be risk. This produces a risk, and so let's share the risk. So this is understandable. Yanis, it's totally understandable, if you sit on the side of the pharmaceutical companies, and, since we are not political idiots, of course that was of concern. And we said, yes, you have a point here, but we have a legal frame, and we cannot step outside the legal frame. And the legal frame is, of course, the European consumer protection regulation, let's say so, but it's for pharmaceuticals specifically, but also in general. And we cannot step outside of that. That took a while that the American lawyers understood that, because for some awkward reasons, the US government had they gave away the consumer protection rights. I'm not a lawyer in that particular way that I can say what they really did. But our lawyers, and especially the commission lawyers, said, we cannot, the commission, and, the signer of the contracts is the European Commission. It's not we, the governments. We are only participating in that contracts in terms that we have the right, to order out of this contract some dosages. That's, on the member state side. But the commission was very clear that they cannot sign a contract which is contradicting European law. So, and that took a while. So I can say not a single contract takes away consumer protection regulation rights for each and every citizen.
But now we know that the indemnification is transferred to the governments.
That's another point. But indemnification is money. This is money, and as we all know, money is always negotiable. It's about pennies and cents, so to say. So that where we came then together, but we didn't give away the liability. The core of the liability rights and the consumer protection rights. That's so important. I have to stress and re-stress that again. Indemnification is money.
Was this an issue that stalled the negotiations or not?
Yes, it stalled. It took a while that both sides, both sides of the lawyer side, so to say, were capable to understand that. It took a while on our side to understand the other side, and the other side had to also came to grips that we have a red line, and the red line was, of course, European regulation here, and I don't, and a European lawyer, a commission lawyer, or a member state lawyer is not very impressed if an American lawyer, a company lawyer, says, you have to change your regulation. No, that's not how we function. So, but that takes a while. It's a discourse, it's a dialectical process. But at the end, it went out fine.
Let's go now to the contracts. Looking back, do you think that the contracts are too weak, or that there is too much carrot but very little stick? Especially because on the manufacturing, you knew that, first of all, most of those products would have to be produced on European soil in order to avert and to prevent having problems down the road. And you knew that AstraZeneca and every other company had multiple clients waiting in line. Should you have been, or could you have been stricter? And there are two angles: should have and could have been stricter when it comes to the usual discussion of best efforts versus legally binding timetables and delivery targets. Because at the end of the day, Clemens, now we are in May 2021. Do you feel that AstraZeneca, but not only AstraZeneca, that they deceived you, or that they lied about their capabilities back then?
See, it's always it always takes two parties to sign a contract. First of all, so no one, neither side was forced into this contract. We all signed it deliberately, and we knew what we're signing. And we don't have the time here to make a legal lawyers webinar now. And when it comes to the expression of what is it, best effort, because what is the character of this advanced purchasing agreement? The character is that you are making a purchasing contract on a product which is not even, doesn't even exist, legally. So best effort in that context means that you do everything to fulfill the obligations out of the contract, and the obligation is to produce, to come to a conditional market authorization, or to a market authorization, to do everything to reach that goal, then also to scale up your production manufacturing capacities to produce the numbers of dosages which are under contract. So this is a very strong thing, and I don't want to go into details now with AstraZeneca because we are meeting in front of the court, and I don't want to jeopardize the court talks, But the thing is that we in that particular way, the European Commission, on behalf of us, 27 member states, is going to court with AstraZeneca, shows that the contract is strong, and the lawyers, lawyers who understand that, they know that this is a very, very difficult situation for Astra now. But let's stop here because I don't want to go further here, because once again, this discussion is now done in front of a judge, and will be solved the one and the other way, and if you're on the high sea on in front of the court, you never know what the results is. But what's other strong concept?
Yeah, could you have been stricter in terms of the manufacturing?
Let's stick a little bit to the example of Astra, and then let's also to compare that maybe with BioNTech, Pfizer. The manufacturing sites are mentioned in the contract with AstraZeneca. It's Astra's problem now to prove why they haven't been capable of scaling them up successfully to supply the European Union from these sites, and it's still open. It's still a discussion. Are the sites in the United Kingdom, are they included in that? Yes or no? The contract is very clear; they are included, by the way. But anyway, this is now lawyers talk, and don't forget that all these companies received quite a bit of money, many million, hundreds of millions, each and every one, to scale up production, to buy the raw materials, etc., to have a production up and running. Why was BioNTech, to contrast that a little bit, capable with the money they received from us, European tax money, to scale up the production in a speed BioNTech probably was surprised of, and we also. You see the quality of companies there, and the management capacities of companies, and in general. So I don't want to be sued by one of the companies, but it's not only science. I think the science behind all the products, all the vaccines we have now in Europe, or received the conditional market authorization, the science is perfect. It's good science. What makes a distinction between this manufacturers is management quality.
Yeah.
That makes a distinction.
But Clemens, I want to insist a bit. Last fall, when I'm sure you had so many talks with individual pharma companies, and they were telling you, I guess, manufacturing, everyone knew that the moment that there would be a successful product, everyone would want it. Back then, what were they telling you? Were they telling you, don't worry, we have it taken care of, we will be able to scale up manufacturing, it would not be a problem? That's what I'm trying to understand, because I remember you in early September last year at the Gastein, at the European Health Forum Gastein webinar, saying that we are already investing a lot of money, public money, as you said also today, to help them to boost the production capacity in Europe. So I want to understand to what extent you were surprised or not surprised by the severe glitches in the scale-up of manufacturing. What was the industry telling you then, and what happened just a few months later?
I already said, there are always two parties in a contract. And even if you cannot lay out everything and every detail in a legal contract, there is still a certain amount of trust. And see, you also have to notice that we were very strict when it came to numbers, because we had high expectation when it comes to supply. Well, when it came to supply, because we wanted, once again, this was our mandate, and all the politicians, our bosses, so to say, behind our neck, they wanted us to have the highest possible numbers of vaccines for the European market, because back then it was already clear that the vaccination is one of the main pillars to come back to normal. So we, on our side of the table, we also wanted a high number of supply. So, and that was, and once again, the lawyers of the companies, they also wanted to protect their interests and said, not each and every time, this is possible. So maybe there was, maybe that there was also the creation of an expectation, which at the end was not able to, we couldn't met, or the producer in that particular way wasn't able to meet. But the other hand is, but the other example and the best practice example is BioNTech, because they are, they are producing much more, which what they put into the contract, on a faster pace and a higher yield. So once again, it's not black and white, because you have to look at each and every company. And I said, I already said it, my impression is, over this many weeks and months sitting together with these companies and hearing them and seeing their approach and their attitude, it's also about, I even would say good and bad management.
And speaking of expectations, I want to challenge you a bit, because both you and Sandra Galina, I remember again also in Gastein last year, in October, you were very confident, or at least you sounded confident, that in a matter of weeks, the whole negotiation process would have been completed. And we are now in 1 year later, almost 1 year later, and the negotiations are still ongoing. Was there over enthusiasm?
Yeah. No. Yanis, to be very clear on that. Yes, there's negotiation with certain companies which are still also in our risk sharing portfolio. But I think the page has totally turned, in the last several months now, in the recent months, because we do know, all of a sudden, and back in June 2020, we didn't know that the mRNAs are the golden standard. We didn't know that. Nobody knows that. And that they are so good in producing and have a secure production line going, et cetera. So that, because many science people who advised us, said, stick more to the traditional ones, to the vector ones, et cetera. And they are having the production problems now, to be also open, and I am not in a blame business here, because one of these CEOs told me once in a more harder discussion, I said to me, Clemens, to produce a vaccine is not pressing orange juice. I understood, and he's right, it is not making orange juice, it's a very complex thing to produce a vaccine,
So
to manufacture.
In October, absolutely. So in October, November last year, did you foresee the manufacturing problems would come your way, at least at your level? I'm not talking at the politicians' level, because then we had the Christmas event by Ursula von der Leyen, that wanted to have the vaccines and the first vaccinations happening in Europe around Christmas. But at your level, were you scared? Were you afraid that there would be scarcity in the first months of 2021?
See, there were two companies where we had a certain number of doses already for Q4 2020. And both companies, by the way, were not capable of supply us on full scale. One was, and the other was not. Didn't even produce wasn't able to put a single dose to the market, because they didn't reach the market authorization also. So yes, there was, we knew, probably in November, we knew very clear that that Astra, we won't see any doses from Astra because we know that they are not making it to the conditional market authorization by the end of the year. So yes, we knew that. So I think, technically speaking, and this is. And maybe let's talk a little bit about the public discussion about this whole process. I think because there is so a high scale of frustration out in the populace, because each and every citizens, not only in the European Union, everywhere, but each and every citizen wants to have this pandemic situation ended, because it is a stress on each and every one of us, and people died, and etc., the economic consequences, the personal consequences, the economic consequences, the grief which comes with this tragic pandemic is led to a high level of frustration, and the frustration created expectation. And some politicians, and I'm not in a blame game here, but this is the nature of politics, to meet frustration if it's in the populace. So I think that there was a tendency to overpromise the beginning when we will come back to normal. For us, the people who negotiated this had this day-to-day, more or less day-to-day contact with the companies. It was always very clear that in the beginning we won't have the big numbers of doses available, because there is a time scale to scale up production. You start producing lower numbers and then to higher numbers, or you have already produced on stock because you are so sure that you reach a market authorization. So both things are, both ways are the approach. But what I think, the high politicization and the criticism, but also in the media, that this is a failure, and this is a big mistake, and why is Israel capable of having secured their need or their demand for doses and the European Union not? All this criticism is forgetting that once again, we purchased for a market for 450 million people, and not as Israel did for 8 million people. It's a big difference. You need theoretically 16 million doses to cover whole Israel, and we do need at least 1 billion doses to cover the whole European Union. That's a big difference, to be frank and honest. And that FDA had a market authorization running maybe 4 or 5 weeks earlier than EMA. This is another story, and that you have to ask EMA why that happened. It has nothing to do with us on the procurement side. Once again, and I don't blame EMA now that they took longer. I think because they also had a mandate, and their mandate was to secure the quality. Absolutely. We didn't want run into a problem that something receives a market authorization where we know internally know that not each and every stone was turned around.
So you said that already in November, it was clear to you, at least at your level, that there would be issues, I guess, with the AstraZeneca contract, right? Because you put all your eggs in that basket, the AstraZeneca, or
no, we didn't.
We didn't. For the first stage.
No, because that's also somehow a little bit a media hype or whatever, a media angle. We had a contract with Astra, 300 million doses, and our first contract with BioNTech was also 200 plus 100, and so there's the same amount of doses. So we didn't put all our eggs only in the basket of AstraZeneca. No. We had a risk portfolio. Yes, we had many eggs of Astra in our bag, but we have very many eggs now or back then already, also with BioNTech Pfizer. So we didn't rely totally on Astra. But as I said, in managing the expectations, also people like me, nationally, I always was talking, yes, now we have the mRNAs, and the mRNAs, and that was BioNTech Pfizer, is a little bit more complicated to handle. Remember back then, minus 60 degrees, storage, blah, 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 all these complications. And AstraZeneca is easier to handle. That was very clear from the beginning. And I also talked publicly and also vis-a-vis my political bosses that with Astra, we will receive quite a huge amount of Astra, and we will be capable of putting them to the primary sector, the primary sector physicians, primary healthcare physicians, to boost our vaccination programs there, and Astra wasn't meeting that expectation, but people like me, we also created that expectation because we wanted to answer the frustration, and we had to say something. Maybe it would have been much wiser in November, December for people like me to have said nothing, said, oh, we will see. But we also would have been scrutinized, why don't you know, So it was this comes on top of it and has nothing to do with the development of the production of that's a political angle on that, and that's frustration and expectation that we could have many webinars to analyze that, but that came on top. I think
my connection is unstable. I don't know if you can hear me. Unfortunately, we have
I can hear you. I can hear you, Yanis.
There.
Yes, maybe. Here you are again.
I'm back. Okay, this hasn't happened. It happened today. So looking back, Clemens, because we have only eight minutes left, what would you have done differently? Is there something that you would have done differently, looking back at the negotiations?
Yeah, and I think Sandra already said that too in a public statement or one of the commissioners, I can't remember. But what we probably we should have done better is not only to negotiate a fair contract, and then do everything on our side, on the regulatory side, so to say, that these products receive a conditional market authorization. But maybe we should also have supported, we supported the manufacturers with quite a bit of money, but checking on them if they're really using that money properly and scaling up their production line, because I don't want to say names now and name a company, but it is maybe in the retrospective. Now we know better. You wonder if one of these larger producers or manufacturers, they are signing then manufacturing contracts with subcontractors very late in the year. Maybe we should have checked on them earlier, so not to run into this kind of problems. But I ask each and every critic also to see that this was a tremendous complex process. Everything was done simultaneously. Sandra and her team in the commission, they did an extraordinary job to jiggle all this. We in the capitals were very busy also to follow them because of the speed, and put all the strategic making the strategic decisions. So I think each and every one of us was so busy that maybe that aspect of the real manufacturing, so to say, wasn't so much under our under our attention. because we thought, oh, we have done a good job. We secured a high numbers of doses contractually. It's the market authorization is going in the right direction. So we thought, okay, we have done everything, but maybe we should have looked more into the manufacturing capacities. This is true at least for one or two companies. This is not true once again for the other company, which is now saving us.
Yes, in any case, this is why for me, it will always be a question, what were the companies telling you last fall, over the last month, September, October, November, in terms of their capacity to deliver? Because
different things, Yanis, different things, because companies are very different. Some companies on vis-a-vis us were very hesitant, very very reluctant to say concrete delivery times, etc., etc. Others were over-promising. Once again, it's a question of managing, and the question of management. I don't want to say more. It's like real life and real people. People are different. Companies are different. The CEO, the boards are different. Different company cultures, etc., etc., etc. This is nothing new. I hope for each and everyone who is listening here, but it materializes in this kind of situation very much.
And Clemens, what do you think of the ongoing patent discussion around IP? And was this a topic during the negotiations at any point?
No, we had a mandate to procure, to buy. We didn't have as a steering board, I'm saying now, we didn't have a mandate to talk about intellectual property. I have a personal view, and some may know that we should have done that. Not we, the community of government, so to say, as a collective, so to say, we should have raised that issue back in May 2020, April, May, when all this started to develop. And there the leaders should have gotten together and say, how do we tackle this issue with intellectual property globally? And it's not on, and there are global technical agencies who are also in charge of intellectual property, and they all slept.
You're poking at the WHO and others, I guess.
No. WHO is not responsible for intellectual property, but maybe WHO also could have done more to facilitate this discussion. But once again, that should have been done May 2020, the latest. Now it's too late, because now we do have the product. And for us in the European Union, the context lost its meaning, because we have supply to a more or less fair price. So in at least the European Union, for us, this is not a topic anymore. And why didn't I personally pursue that maybe in October, November more? Because, and I mentioned that also somewhere, I think in a public discussions somewhere where I was participating, I said, it lost its meaning at least for the European Union, because we are receiving a fair price, so the issue of the intellectual property is secondary now. But it's not secondary for the global supply. And you see it, and we all see it, that if, like WHO, COVAX, so to say, is relying so heavily on the production capacities of Indian manufacturers, then we have a problem. We have a problem, because all of a sudden we notice that India has a big problem, and we won't see any Indian vaccines around the world for quite a time now. So I think the global community should have started this discussion much earlier, back in 2020. That didn't happen. Is that a catastrophe? No, it's not a catastrophe. Is it a shortcoming? Yes, maybe we should have done it, but now it's too late. Now it's spilled milk now. And I think most of the companies, they are collaborating already with other manufacturers to scale up production.
Speaking of other vaccines, when was the Russian or the Chinese vaccine on your radar during the negotiation? Did you have it on your radar? And if it wasn't on your radar, why not?
The Chinese never were on our radar because, one of the principles for us as a procurement of buyers club, so to say, was, is does this product ever receive a conditional market authorization under European regulation? And that limited, of course, the candidates and the numbers of candidates tremendously, because I'm not an EMA expert. You are sitting on the board of EMA, but I don't think that a Chinese vaccine ever received a market authorization for the European market. See, the Russian discussion was a little bit different. This discussion is different, because the developer of this Russian vaccine has a high reputation, and I'm sitting in Vienna, and we don't have a problem with Russia, so to say, because this historically, and also so I'm not in the business of Russia's skepticism or whatever, but for us, and that was always very, very clear. Are the Russians or the Russian authorities behind the development of these vaccines capable of presenting a dossier to EMA for a market authorization? And that was our concern. And this is, and yes, there were, of course, talks, official talks also, but we had not the impression that the Russian manufacturer or developer was able to put the dossier together which fits the demands of EMA. And so this was the reason why it was not on the radar. And you know what happened? They traveled around the European capitals and tried to talk certain governments into contracts, and I think 2 or 3 actually signed the contract, which is now creating other problems.
And the legacy, there are questions in the Q&A chat room. The legacy of this joint procurement initiative, the EU vaccine strategy, what is it for broader medicines pool procurement in Europe, in your opinion?
See, since I was always very much involved in my professional career so far to Europeanize pharmaceutical policies, because I'm obviously coming from a background of a high-income country, so access to medicines never was an issue for us as Ministry of Health or as a market, etc., 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 because we are used to pay high prices. But about many years, and some of our audience know that, I always was advocating that we have to Europeanize that. What we have now in our basket is a best practice example that in a critical situation, the 27 member states together with the European Union is capable of procuring, negotiating at contracts and prices which are fair. And if that has a legacy, this vaccine procurement, is that we should put this as a best practice and continue doing the same thing when it comes to high-priced, innovative medicines for the European citizens. Because 2 of us, and many probably know, that there is no fair access within the club of the European Union when it comes to innovative medicines. There are first ones, like my country, but there are second or third one member states. And with this vaccine procurement, we proved that there is no first, second, or third line, that we are all first line. And I think that we should take on, legacy. And that should be the legacy.
And last question, what happened? Why did you resign?
I was, I think I tried to manage to describe it a little bit. I'm the victim of this high politicization between the triangle of frustration, expectation, and reality. That's, and if it's getting so politicized, you have to know where is your role, and as and if you're exposed to do certain things, then there's a moment where you say, okay, business is over. It's getting to your personal identity and integrity, and stop politicking. And that's what I did. I stopped to put the politics on my shoulder. And I haven't done anything wrong. In the opposite, if I look at my Austrian numbers, vaccination every day, I do know that we all did a good job, and I think we all did a good job. And really, and I have to say that, starting from the President von der Leyen and the commissioners and the technical staff, Sandra and her team, and we in the capitals, I think we did all a very, very good job. And it's, of course, up to others to judge that. But from my self-reflection, I think we did everything right so far. Once again, we touched certain topics where we could have been done better. But the overall, Yanis, think about, in July, latest in August, but in July, we will have potentially 70% of the eligible population within the European member state immunized. They will have got their jabs. Is that a success story? Yes, it is. Has that something to do with our joint effort? Yes. Is this also the good job of some manufacturers and science? Yes. So we should take it as a collective story and a success story.
Absolutely. Clemens Auer, thank you very much. We've gone 6 minutes overboard, but I think it was very much appreciated, and we covered a lot of ground. Apologies if I didn't manage to pick up all of the questions. There were quite a few questions in the Q&A chat room. I tried to cover as much ground as possible. Thank you for your openness. This is an ongoing discussion. I think we're still in the eye of the storm, but we can draw some early lessons, especially looking ahead. How will this shape future joint procurement and pool procurement initiatives on the EU level? Ladies and gentlemen, thank you for joining us, and see you for the next episode of EPHA's Access to Medicines Dialogues in June. Thank you very much. Thank you, Clemens.
Ciao, bye-bye.